All right, guys, this is Super Mike 2164. I'm gonna re-record this, just upload it. Try to do it live, but it doesn't work on the phone. But I do want to read this thing here: 5 warning signs from blackdoctor.org. 5 warning signs of cancer caused by oral sex. According to recent reports, oral sex is now the leading factor in the recent surge in throat cancer cases. And like I was saying before, in this society, especially in America, there's a lot of behaviors out here that we think are harmless, but they have real life consequences. A lot of people nowadays, they mimic their sexual behavior after porn. And porn is like an advertisement of some of the raunchiest and this most disgustingest type of sexual actions you can find. A lot of people are dirty. There's a lot of dirt going on around here. A lot of people do some of the dirtiest stuff. You know what I'm saying? Anal, and then they go vaginal, and then they do oral. And it's real disgusting. And why didn't y'all think something was going to be wrong with that? So let's just go through here. People are pressured to augment their bodies. Guys are pressured to get extra money and pretend like they got money so they can attract women. Women are pressured to get fake BBLs and stuff like that, and just phony. And this stuff is having real life consequences. So here's one of the consequences of some of just current behaviors. So Dr. Hisham Mehena, a professor at the Institute of Cancer and Genomic Scientist at the University of Birmingham, recently came out saying that there has been a rapid increase in oropharyngeal cancer, a type of throat cancer, in the past 2 decades, calling it an epidemic in both the U.S. and the U.K. So somebody wrote on the last thing, is this just in the U.S.? No, it's in the U.K. too. It's an epidemic in the U.S. and the U.K. So for oropharyngeal cancer, the main risk factor is the number of lifetime sexual partners, especially oral sex. Mehena wrote for The Conversation, those with 6 or more lifetime oral sex partners are 8.5 times more likely to develop oropharyngeal cancer than those who do not practice oral sex. HPV is the most common sexually transmitted infection, with 3 million new cases in the U.S. each year. Many people will live their lives without ever knowing that they have HPV, but for some, it can develop into cancer. So 3 things that everybody should know about HPV. The human papilloma virus causes 70% of oropharyngeal cancers. Of the 100 known strains of HPV, about 40 can spread through direct sexual contact to the genital areas, mouth, and throat. While most HPV strains are harmless, at least 9 of them are known to cause cancer, says Dr. Alan Ho, director of the Head and Neck Cancer Program at Cedars-Sinai. So HPV 16 to 18 are the most common high-risk strains that can cause oropharyngeal cancers, also known as throat cancers or cancers of the oral pharynx. The oral pharynx encompasses the back of the throat, including the tonsils and base of the tongue. And of course, that's basically what people are, proud, especially on porn, to try to do those type of things. And so, including tonsils and tongues, those strains are also associated with anal. So people are going anal and then doing oral. Do you understand how disgusting that is? It sounds like, just some of the worst stuff that you can do. But I think this is just what people are out here doing. It's an epidemic. Those strains are also associated with anal and cervical, vaginal, and vulva cancers in women, as well as anal and penile cancers in men. But this is interesting. It says men are at higher risk. According to Cedars-Sinai, when it comes to oropharyngeal cancers caused by HPV, there's not much research on the risk of getting the virus from giving oral sex to a man compared with giving oral sex to a woman. However, we do know that HPV-related oropharyngeal cancer is twice as common in men than women, says Dr. Chen. The concentration of HPV in the thinner, moister skin of the vulva is higher than the amount in the thicker, drier skin of the penis, which may affect how easy it is to transmit. But there could be other factors that explain the difference. Tobacco and alcohol use may increase risk, for example, and both are common among men. The number of sexual partners matters too. There's evidence that oropharyngeal cancers are more common in people who have had more than 20 sexual partners, says Dr. Ho. Dr. Ho, interesting. Anyway, HPV is very common, but most people with HPV will not get cancer, won't get cancer. Some 80 to 90% of sexually active people will get HPV at some point in their life. Although most will never even know it, says Dr. Ho, whose research focuses on identifying biomarkers to detect which HPV strains are likely to recur and be dangerous. The body usually clears the virus without trouble. Interesting. In some cases, however, the virus will remain in the body and lie dormant, and it can reawaken years later as cancer. It can take decades after being infected with HPV for cancer to develop, says Dr. Ho. It's also unclear if having HPV alone is enough to cause oropharyngeal cancers. It's possible that other factors like using tobacco may interact with HPV to cause these cancers. Still, the risk is low. While oropharyngeal cancers have been on the rise, fewer than 1% of people who get even the high-risk strains of HPV will go on to develop a related cancer, says Dr. Ho. 5 warning signs of oral cancer to look for. If you got a sore on your lips or mouth, your healthcare provider should evaluate a sore irritation that lasts longer than 2 weeks. The Cleveland Clinic says that sore may appear reddish on your lips. If you have darker skin, it may appear brown or gray inside your mouth. The sore may occur as a red or white sore that doesn't heal. Number 2, patches in your mouth or throat. The Cleveland Clinic says that patches inside your mouth you cannot scrape away can indicate. Okay, now they want me to do some clickbait to do the next one. Can indicate what? Leukoplakia is the word to describe flat or white or gray patches in your mouth or throat. Erythroplakia describes a slightly raised or red flat patch. Erythroleukoplakia describes the patches that are both red and white. Number 3, difficulty swallowing, sore throat. Difficulty swallowing, dysphagia, or a sore throat, pharyngitis, that doesn't go away can indicate cancer. According to John Hopkins, you may feel as though your food is stuck in your chest or have increased pain when swallowing. Hoarseness, laryngeal cancer, the area that causes that contains the vocal cords, can cause hoarseness or change in your voice. See your medical provider for hoarseness that lasts longer than 2 weeks. A neck mass. Typically, oropharyngeal cancers are asymptomatic. A lump in the neck is one of the first signs of throat cancer and should be evaluated by a medical provider. So less common signs of cancers: ear pains, noisy breathing, coughing up blood, weight loss, and loose teeth. So that's all I'm going to read, guys. Be careful out there. You want to do things that bring positive vibrations to your life. There's a lot of other ways to satisfy yourself than just going out there having illicit, random, raunchy, gutter sex. I mean, there's a lot of other ways out there. And a lot of us come from situations where, we grew up in places where, the mama or the daddy was a pimp, or the mama was a dancer in a club, and, you might have had a lot of porn around, and, so you think that this is love, this is sex, this is the proper way, and this is all it is to it. Weird gutter sex, and that's it. It's not. And this is just one aspect. But, you can go accomplishing goals. You can buy houses. You can get into real estate. All of those things can actually satisfy you. And you get you a partner that will stick with you, hang with you, be your partner, and be your best friend as you're doing good things. That's going to go a lot further than having, 1,000 different sexual partners, freaking yourself out mentally, into situations where you eventually setting yourself up. It creates a lot of danger for you. So, this is all wellness here. So we just doing wellness. And let me know what you guys think. Hopefully you guys listen to it, because I did do this live, but I don't think it worked. So that's it. Peace out, guys.